Do you think that hot flashes and night sweats are just a sweaty nuisance or something that you just have to put up for maybe the next 7 years, maybe the rest of your life? Well, stay tuned to discover why treating your hot flashes and your night sweats could actually literally save your heart. Welcome to MenoThrive, where we delve into the latest menopause research and bring you the information that matters most about your health. I'm your host, Dr. Deborah Brunt, menopause specialist, and I'm here today to discuss with you the connection between hot flashes, night sweats, and heart disease. So let's dive in. So in the medical world, we call vasomotor symptoms of menopause hot flashes and night sweats. So what that experience can feel like for some women is this internal rising of heat that rises up through the body, and then often it can be associated with redness in the face, profuse sweating, drenching of clothes in severe cases, or drenching of bedclothes. They've traditionally been the classic menopausal symptom. So a lot of women think if they don't experience them, they're not experiencing perimenopause, which is not true. They often actually occur much later than a lot of the other perimenopausal symptoms. So women might experience dry skin, dry vagina, and they might experience fatigue and weight gain. They may experience some mood changes well before the hot flashes or the night sweats appear. So hot flashes occur in around 60 to 80% of perimenopausal and menopausal women. The peak time of severity and frequency is around that year after the menopause, when estrogen levels drop low and the brain has not yet adjusted to those low levels of estrogen. And these hot flashes can carry on for about 7 years. For some women, it can be much longer, 10 to 15 years. For around 20% of women who experience hot flashes and night sweats, they're considered to be super flashes, and they can have lifelong from perimenopause onwards. That's not so great. So although hot flashes and night sweats can be extremely uncomfortable, they can disrupt sleep, they can disrupt work, they can disrupt quality of life, and that's reason enough to have them treated. There really are some important connections between heart health and hot flashes that need to be discussed. So I want to discuss a study that was published in the American Journal of Obstetrics and Gynecology in 2020. This study pulled the data from over 6 studies, and there were over 23,000 women that were followed from an average of 48 years of age to around 59 years of age. And during that time, 8% of these women experienced cardiovascular events, which included heart attacks as well as strokes. So that's a significant amount of women, considering how young these women actually were. This study found that if women were European, had lower education levels, were overweight, or were on HRT, they were more likely to report hot flashes or night sweats. Importantly, the study did find that the severity of hot flashes was related to an increased risk of heart disease. When it came to night sweats, both the frequency and the severity were associated with increased risk of heart disease and heart events. And there was a dose-related response. So the more severe or the more frequent your night sweats, the higher your risk became. So some of the mechanisms that we know that are the cause of these increased heart risks include increased cholesterol levels, increased blood pressure, as well as increased insulin resistance. So these are associated with hot flashes and also associated with increased risk of heart disease. However, there are some other reasons why women who experience hot flashes and night sweats are also at risk of heart disease. So a study that was published in the Menopause Journal in 2017 gave us some insight into the association between hot flashes and the capacity for the arteries to what we call vasodilate or expand. So this study looked at 272 women. It measured their hot flashes, and it also used ultrasound to look at the brachial artery, which is the artery in the upper arm, and it looked at these women's capacity for their artery to vasodilate or open. So women who had more hot flashes had lower vasodilation capacity of these arteries. And we know that this is called endothelial dysfunction. And we know that endothelial dysfunction is a risk factor for heart disease. Similarly, another study that was published last year in 2023 that demonstrated another study of about 276 women. It measured their hot flashes as well, but it also correlated this with markers of inflammation. Women who experienced more frequent hot flashes had higher levels of high-sensitivity CRP, and that is a marker of inflammation that's associated with a number of chronic diseases, not just heart disease, but also diabetes, cancer, and other disease risks. So women who had more frequent hot flashes had this higher marker of inflammation in their system. So besides endothelial dysfunction and higher inflammatory markers, we know that hot flashes and night sweats also impact a woman's cardiovascular risk by impairing her sleep, which is a separate risk factor for heart disease. So when you've got disrupted sleep, disrupted circadian rhythm, we know that that really impacts heart disease risk. And a fourth mechanism that is likely to be at play is when you have a dysregulation of temperature coming from the brain. This is a symptom of a dysregulated autonomic nervous system, which is a neuroendocrine pathway that connects the brain to the adrenal gland. We call it the hypothalamic pituitary adrenal axis. But this neuroendocrine pathway, which modulates stress responses, if that is dysregulated, this also has an impact on heart health. And so we know through these four important mechanisms that if you're having frequent or severe hot flashes, there is this increased risk of cardiovascular disease. So before we wrap up, this brings us to the really important topic of treating hot flashes. Should they be treated? Yes, they should. Should they be treated purely for quality of life? Yes, that's a great reason. We want you to be able to enjoy life, do the things you want to do, have fun, and not experience issues because you're sweating or feeling hot or uncomfortable all of the time. But it is really important that these symptoms are treated because they are a cardiovascular risk factor for you. We know that treating hot flashes reduces inflammation, improves endothelial dysfunction, reduces blood pressure, reduces cholesterol levels, improves autonomic regulation, and improves sleep. So these are some really important reasons why using estrogen hormone therapy reduces cardiovascular disease risk. If you're experiencing hot flashes or night sweats, I would talk to your health provider about effective treatment strategies for reducing these symptoms to help your heart. Your heart will thank you for it. That's all for today's episode of Men Thrive. If you find it helpful, subscribe and share with anybody that you think would find this content helpful, and we'll hopefully deliver you some more information in the near future.